Welcome to Wellness Through Physical Therapy. I'm Paula Degnan. Tingo is here! Yay! Haven't seen you in a while.
Yeah, I've been, I don't know what I've been doing.
Well,
But yeah,
I think you've been bringing a lot of different things here to your building and great things to help people. Now today, watch everybody on the couches out there, Ting. Back pain. Wow, they just all turned up their TVs. What are we talking about back pain?
So, one of the things that I've been doing is learning how to do some diagnostic testing for back pain, and learning some cool, interesting tricks to one, not only identify what's causing the pain, and two, everyone's heard about a pinched nerve, right?
Yes.
So there's this new study that we're doing. It's kind of so new that there's really no name to it yet. So I'm just calling it a functional nerve conduction study. So what it can do is, one, it can tell whether a nerve is being pinched potentially, and two, it can tell when it's being pinched, like which position you're in. So that's something that we're doing. We're getting some good results with it as well. And some of the testing that we're doing, including EMGs and ultrasound diagnostics. And we've been finding that people who we think might have sciatica may not have sciatica. It might be a nerve. Or people who we may think have a problem like heel pain might actually be sciatica. So we're doing things, the diagnostic testing that we've been doing allows us to be able to differentiate all these problems. And it's very important because according to the medical profession in general, we're told to kind of lump low back pain into three major categories. One of them being non-specific low back pain. And guess how many people are put into that category?
Most.
80%. So,
most.
So we're trying to treat people with non-specific low back pain with non-specific things, and this just allows us to get more specific with it and helps guide our treatments.
Wow. When we talk about back pain, and you brought that up there about the lower back pain, the back is...
Yes.
There's a lot of space back there.
Yep.
And then you mentioned plantar fasciitis, which may not be really that, but could be sciatica. So now you're going up into the leg, and again, everything's attached, but it's not all stemming from just one area.
No, you got to try and figure out what the source of the problem is. So, like for example, if we think someone has plantar fasciitis when it's actually coming from the back, we're going to treat the plantar fasciitis, which typically won't help. Or if we think someone has sciatica, we're going to treat the back. But if it isn't sciatica, but instead it's a nerve being pinched at the knee, which is quite common, I just saw one of those people, treating the back isn't going to help it because we have to treat the knee. So being very specific with that is very important, and being able to identify exactly what the cause of the problem is kind of like where all this is leading us here.
And when we're talking about this then, what it almost says to me is there may be people who are saying, I've been having treatment for, we'll go back to plantar fasciitis, and nothing seems to work.
Right.
No matter what I do, no matter what type of shoe I buy, no matter...
Yeah, well, first of all, we can do testing like ultrasound testing to see if it is plantar fasciitis. And if it's not, then we have to look at other areas. So for example, I recently tested a lady who was getting pain down the leg into the foot, and her leg was dragging. So she was referred to us with sciatica, and she was actually scheduled for an injection of the back. So we did the EMG on her. We found her back was fine, but she had a pinched nerve right here in the knee. So one, obviously we located the problem. Two, we saved her from a invasive procedure that may not necessarily have helped. And three, we were able to start treating the proper source of the pain, which hopefully will get her better. We're just starting to treat her, but you know, she has a better chance treating the right location.
Well, what a wonderful thing to be able to say we found the problem, now we can treat it instead of we think we found the problem.
Right.
When we come back, Ting is going to share some more information about back pain. We're going to talk about some of the measures that he had mentioned earlier, and a lot more. So don't go away. Wellness Through Physical Therapy returns. Welcome back to Wellness Through Physical Therapy. And Ting was telling us about some of the diagnostic equipment that he has available in order to find out exactly where the problems occur. And we're going to see that now. So what exactly is this machine? It looks like a laptop.
Yeah, it is a very fancy, expensive laptop. But yeah, so the machine is an EMG/nerve conduction machine. So what I had referenced before was about being able to tell whether people have a pinched nerve or not. So the way we do that is what we do is we pass an electrical impulse from the electrode that we have in the back of your knee. What that impulse does is it travels to your back, and then it comes back down and makes your muscle contract. I'm sure you felt that, right?
So what you're doing now is you're actually putting on the
electrodes themselves.
That's what they're called.
Yep,
Okay.
yep. So what we do is we pass an impulse, like from the top electrode in your knee. That impulse travels up your nerve into your back, stimulates a nerve in your back itself, and sends a signal down into your calf muscle, which makes it kind of twitch, which is what you kind of felt, right?
Now, the first one you did was just considered the baseline.
Yes, so the baseline. So we want to see how much of an impulse is getting from where we started back down to your calf again. And when you're standing, most people have an impulse that travels all the way up and down, and it creates a graph like we saw on the monitor. So what we then do from there, if we know your baseline and how much impulse is supposed to get there and back, we can put you into different positions now. So we'll have you bend over, and we pass that same electrical impulse through to your back and down to your leg, and we can see if that graph that we see again, that peak, looks the same or not.
And what's the purpose of that? What if it didn't?
If the nerve was being compromised or being pinched, it's kind of, think of it as a hose, and the water isn't getting through. So that if that electrical impulse is hitting the back but not getting back into the leg, that means something is pinching off that impulse and not allowing it to flow all the way back. So in that case, that wave that we see is going to be significantly smaller, or in my own case, which we will see, it was basically flatline. So zero impulse was getting from the spine down to my muscle, which I had sciatica around about, guess it was the beginning of the winter, so it would have been about November, December. And I did this test obviously on myself. I was one of my guinea pigs, and found there were certain positions that I got in, mainly in what we call extension or leaning backwards, and then leaning to the right, where my nerve was being completely pinched to where no signal was getting up and down.
So how would you know where that nerve was from looking at that?
So the functional nerve conduction study tests specifically one nerve. One of the most common nerves that gets pinched in the back is the S1 nerve root.
Oh, okay.
Okay, so not everyone has a pinched S1 nerve root, but the other components of the nerve conduction studies that we do in the EMG, we can actually determine exactly what nerve and what nerve root is being pinched. And when I say nerve root, for the people that have had back pain out there, have had studies like MRIs, that type of stuff.
Right.
And they've talked about a L5 S1 herniation or an L4 L5 herniation. So we can determine if the pinched nerve or the problem that you have is either at L4 nerve or the L5 nerve or the L3 nerve or the S1 nerve.
And this isn't something that you would be able to see on an MRI or?
So MRIs are very, there's a lot of what we call false positives on MRI. So if you took 100 people in a room over the age of 50 with no back pain and you put them through an MRI, have a guess how many people would show a disc problem?
My guess is probably a lot of them.
80%.
Really?
So there's a lot of potentially things that you'll see on an MRI which may not necessarily correlate to the pain that you're having. Okay, so MRI in itself is not necessarily a good diagnostic, and so I should qualify that. It may not necessarily be a good diagnostic for low back pain.
Oh, okay.
And the American College of Physicians, forgive me if I'm wrong, but one of the major organizations in the United States actually only recommends an MRI if you want to potentially have surgery get injections, or if you're thinking of like serious back problems like cancer, fractures, all that type of stuff.
And you had mentioned that you actually have been using the equipment here.
Right.
And you have had very good success with
Yes.
being able to tell actually at least one of your patients
Right.
that this is what was happening and
Yep. Yep, to reference just a couple of patients, the one severe one that we came across, she had been in back pain for like 5 to 10 years, been everywhere, injections, physical therapy, chiropractic, all sorts of stuff, and she basically came in like bent sideways. What she told me that day was, you know, this is my last resort, surgery if this doesn't work. So this was when we were like very new with this procedure. I mean, we're still new because it's something that, like I said, is extremely new. I talked to her about it and I said, hey, this is potentially something we could do. So we identified what we call her compromising positions, or the positions where her nerve was being pinched.
that's fascinating.
And then we identified her optimal positions, or what we call the positions where her nerve was functioning at its best. So we encouraged her through her daily life, modification of her lifestyle, to encourage her to be in the positions where her nerve was optimally at that best. I don't remember exactly what it was, but imagine it was right side bending. So what we did was we had her, whenever she could, lean to her right, put a little lift on her left shoe, had her sit on a book, and we discouraged her from her compromising positions. Again, I don't remember what it was, but whatever it was, we said, don't do this. And then treatment obviously focused more on stretches into the positions where optimized her nerve. And so I'm happy to say that through what we did, essentially now she is relatively pain-free. She's standing upright. She's walking about a mile or two with her husband every day. And surgery, I believe, is not something in her near horizon.
Wow.
So
that to me is an incredible.
yeah, it was a very good outcome.
Yeah.
Because like I say, this is something very new, and it's something that we're kind of not experimenting with, but we're pioneering as such.
Well, and I have to say, it's a little bit of a jolt, but it wasn't uncomfortable. So I will attest to that. Now, don't go away, because we have so much more to talk about back pain and all of these different modalities. Wellness through physical therapy. We'll be right back. Welcome back to Wellness Through Physical Therapy, and Ting has been telling us about the different modalities that they have here that can help people who, as you mentioned in the last segment about the woman who was actually at her last resort.
Pretty much, yeah, because what we want to do is, one, obviously identify what the actual problem is, and with her we identified that it was a pinched nerve. And two, we want to try and identify specifically what pinched that nerve, or what positions make that nerve pinch, and what position helps that nerve function optimally.
What happens if a position doesn't make the difference? Is it possible to have a pinched nerve that you would have to go physically in and do a surgery?
Yeah, there potentially is like a mass or something, that if there's a mass, like
calcification.
Calcification, something that's pinching on a nerve. Yeah, in those cases, surgery is indicated, definitely. So what we want to identify, though, because if you came in, let's say I did your test, because your tests look completely normal. You're never normal, but the tests look normal.
The tests look normal.
So if someone came in with severe pain raging down their leg and that test looked as good as your test did, we can say, hey, it's not your problem.
Ah.
Okay, so this helps rule out something as well. So we can say, hey, Paula, the pinched nerve definitely is not your problem. I believe you should go back to your physician and get checked out for other things.
Ah,
okay, so it can rule in a bunch of stuff, and it can rule out a bunch of stuff as well.
So there is no all in all
encompassing.
But there are, at least we know now, there are other modalities. Now, so let's go back, and you said that, you know, even with your own, when you did your own test, you said that the way around what you saw was, again, you changed positions.
Right, position. So, yeah, my test showed, so as a physical therapist, and if there's any physical therapist out there watching, it was completely against my mindset of what was creating my problem. Okay, so my sciatica was on my left side. It was down in here, and I was actually unable to put weight on my left leg for about 2 or 3 days because of sharp pain down in my calf. So classically, when you're thinking about a pinched nerve on the left side, you would think that leaning to the right would open up I don't know if you know.
Take the stress off.
Yeah, basically. Yeah. So, and traction. A lot of people think of traction on the inversion tables, that type of stuff. So guess what I did the night that I hurt myself? Did a lot of right side bending, and I did a lot of what we call Kensi exercises, which is leaning backwards. And that's a protocol that a lot of physical therapists, myself included, Mackenzie's from New Zealand, I'm from Australia, so we're kind of kin. But I did a lot of side bending to the right to try and open up my left side. I did a lot of Mackenzie stretches, leaning backwards to try and, that exercise is designed to help the discs relocate themselves back to where they should be. So the next day, no,
didn't work.
I felt really bad the next day. Not worse because I didn't feel any better. Potentially worse. So, and I'm thinking to myself, okay, I remember I was at this conference. I remember the study that they did. The guy said he did great with people that were needing surgery. So I was like, all right, let's give it a shot. So I came in on the Sunday. I don't know if who was here, but I hooked myself up, and then I did the test myself, and I found that my compromising position on where that nerve was being pinched the worst when I was leaning to the right and when I was extending back. So I was doing things the night before that was pinching my nerve even worse. And it was against all logics of what physical therapy that we had learned in the previous past. So the gentleman that developed this test, his name is Dr. Sabahi. He's a physical therapist out of Texas. Actually said he believes Mackenzie protocols are wrong.
Oh.
That's what he said. He said it's only about 10 to 20% of people that he finds the optimal position is extension. And Mackenzie protocol is based a lot on extension exercises. So, and I found that myself. So what I did was I encouraged myself to lean to the left most of the day. So imagine me laying down with a pillow under my left hip most of the day. If I needed to sit, grab myself a book, trigger point therapy, stuck it under my left butt cheek so that it would throw my body to the right. And because I don't want to be sitting like this all day, I had to lean to the left.
Oh.
So I spent my day like this if I wasn't laying down. And if I needed to walk, I got myself a little heel wedge.
Oh.
And stuck it in my left
heel. Just
heel.
that much?
Yep, stuck it in my left heel. And what that does, again, it makes my left leg longer, which throws me to the right. And because I don't want to be walking like this, I lean to the left.
So now it worked?
Classically, that severe of a sciatic pain I've never had before. And I know when my back hurts, because the day before I was doing a lot of work around my camper. So bent over a lot. Mm-hmm. So I know from previous that if I was to do that a lot, my back would hurt for maybe like about a month. And my wife would be yelling at me, why aren't you standing straight? You got your butt stuck out, you're leaning to the side.
Dang, not you.
Well, I have to do work around the house too.
I know, but I'm just amazed that you would be in that kind of shape.
Yes. So,
don't you know anything about physical therapy?
Yes, which is why potentially previously I would have done Mackenzie exercises, and who knows if I was doing myself a detriment or not. So basically this time, after identifying my optimal and compromising positions, I got myself in those positions, and this happened on a Saturday, and by Monday I was about 80% better.
So,
and Monday I had one of my therapists do some work on my back as well along with it. By about Wednesday I was the pain was essentially gone.
So there you have it. All you have to do is get the right diagnosis, mm-hmm. and then be able to find somebody who can guide you to the next step.
Right.
Well, if you're wondering who that is, I'll tell you more about Ting when we come back. Wellness through physical therapy will continue. Don't go away. we're wrapping up Wellness Through Physical Therapy today, and Ting, I'm just, again, I don't even know what to say. So
Yeah, it's
there's so much going on.
Yeah, there is a lot. New technologies coming out, like smart people are coming up with new things to do, and the best thing I can do is find these smart people and find what they're doing. And one of the great things that we've introduced in the last year has been to be able to I mean, we have always prided ourselves in being able to find people's problems. Mm-hmm. And if you've watched the show before, I've talked about a lot of identifying the problem. So a recent study came out, I don't remember what journal it was, but it was pioneered by a physical therapy group out of New York. And what they found is when you got diagnostics into the equation, and they took people and put them through diagnostic testing, either EMG, nerve conduction studies, ultrasound testing, or some other studies that they do, the plan of care changed in 62% of the time.
How do they find you? Because you have all this. Where do we find you?
Give us a call, 570-501-1808. You're welcome to look for us on Facebook, Fyzical Hazleton. And also, we have a website, fyzical.com/Hazleton, I want to say. Brian will put it down there if I'm wrong.
It'll all be right there on the screen.
Yeah, so give us a call, and we always offer people in WYLN, give us a call. We'll get you in for a 20-minute question-answer session. We can go over your individual problem and see if it's something we can help with.
And see us again soon. Wellness Through Physical Therapy.